not making appropriate decisions. There are disability support workers arriving at the door either in single or in pairs, unmasked. So the disability service providers are not consistently making appropriate decisions, and it is placing people who are already highly vulnerable at significant risk. Minister, I just want to go back to your statement about the things that we can change to improve lives. We could change, for example, the requirements on disability service providers so that when they go into the homes of clinically vulnerable disabled people, they're not placing those people at risk, couldn't we?
Is that the question?
Yeah.
I think I've really answered this question as comprehensively as I can. We have asked of all service providers that they have their COVID plans in place. It is not mandatory to have the wearing of masks, but of course there is that individual choice for people with disability and people without disability, for those who work in the sector as well as those who operate in the sector. And, you know, we've been following public health advice, and we follow the directions of the State Health Department.
No, well, I dispute that public health advice is actually being applied. It's become very politicised, and that's a matter of historical record. Do you accept or acknowledge that the lack of broad mitigations in our community, and even if you don't support masks as the simplest, cheapest way to stop people from being infected, there's a whole range of things that government could do, or service providers or businesses could do around ventilation and filtration, those things you talked about earlier. But do you accept that the failure of government to provide any mitigations at all excludes people with disability from society because they're worried about getting infected or reinfected?
So this is something that I have raised with my disability advisory group, and that we have had discussions around this. I don't think it's fair to say that we haven't provided any measures to protect people with disabilities.
Apart from vaccination, what?
I don't think it's fair to say that we haven't provided people with disabilities with you know, anything. There is the encouraging of mask wearing amongst vulnerable cohorts, but it is not mandated. And to be fair, the state does not have a role in regulating the disability workforce, and you know, the Commonwealth takes heed of public health advice in the regulations for the sector. And again, you know, people can make their own choices, and I think you know, if service providers choose to have masks as part of their plan, then there's no issue. Obviously.
Thank you, Minister. I'd like to understand how a person, for example, who lives with a cognitive disability or a psychosocial disability that has a profound impact on their life's functioning, is able to protect themselves. It's actually kind of confronting to hear a Minister for Disabilities say that people who have cognitive or acquired brain injury or psychosocial issues should be able to take personal responsibility every time. Like, it's quite ableist.
Sorry, what was the question?
Well, do you accept that it is ableist to say to someone who has psychosocial or cognitive or intellectual disability, you need to take personal responsibility for your own health? Given that we provide in-home supports and care, and therefore we acknowledge that people with disability need potentially an extra level of support to live independently, do you agree that it's ableist to say to the whole cohort of people for whom you're responsible, you need to take personal responsibility?
I think we've made it very clear that we are following public health advice.
What is that advice?
Also,
Ms. O'Connor.
And also, again, to reiterate that the Commonwealth, I assume that the Commonwealth takes heed of public health advice in relation to the sector, and we have put in place numerous strategies, including vaccination, which I know doesn't
prevent infection. No, it doesn't prevent infection.
Ms O'Connor, please.
I'm just trying to help the Minister understand.
No, Ms O'Connor, you know exactly what you're doing. Thank you.
Yeah, I certainly do.
And again, we know that people have the opportunity to make these choices. We know that service providers in this space this can also be part of their plan. And I think there is recommendation or encouragement that people, vulnerable cohorts, do wear masks if that is your choice. Also for NDIS providers, the NDIS Quality and Safeguards Commission remains the lead agency providing regular advice, certainly to registered NDIS providers, and information about provider requirements.
Thank you, Minister. Do you understand that the way society is currently geared, where we have governments who've decided to let a novel coronavirus with long-term disabling effects rip, excludes people with disabilities and other clinically vulnerable people from society?
I think it's important to remember that whilst mask wearing, which is where you're going to,
no, I'm not.
Is not mandated.
There's a range of measures.
There is a range of protections. One of them is mask wearing, and people have a choice if they wish to do that, if they feel that they are vulnerable in a certain setting.
How can you say that to someone with a cognitive disability?
Ms O'Connor, the Minister is still answering the question.
But the Minister
Thank you. Ms O'Connor, we've only got 20 more minutes to go. Can you please not interrupt the Minister while she's trying to answer your question? Thank you. Minister.
So there are a number of things is the wrong word. I do actually feel, with respect, that I have answered your question. I feel like I'm not quite sure how this actually relates to the budget.
Are you serious?
To be fair, I have made it very clear to you. I've given you information about the vaccine rollout for people with disabilities, how it's comparing nationally. I've told you that disability services and workers in this space, of course, can wear a mask. It's not mandated. That is following public health advice. But if